Hello, I'm Dr. John Chan. I just finished a very busy outpatients clinic today. So many patients today. 3 of them had mitral valve replacement surgery. One of them had a surgery 9 years ago and she's doing very well. The other 2 patients had their surgery last month and both are also doing very well and are back to their normal activities already. Most of the disease mitral valves can be repaired rather than replaced. But 2 of the patients I saw today had a bad infection of the mitral valve. And this had destroyed so much of the valve tissue that it was not possible to repair the valves. They were both rather young patients, so they had chosen to have a mechanical valve replacement. An advantage of mechanical heart valves is that they do have a very long durability, usually for the lifetime of the patient. But we need to thin the blood down to prevent the valves from clotting. So they all need to go on a medication called warfarin. This does interact with food containing vitamin K, such as green vegetables. So there's some dietary restriction for these patients. And we need to do a blood test every 1 to 2 months to ensure that the blood is thinned to the right level and not too much. We can also use a tissue heart valve. These have a limited durability of 10 to 15 years in the mitral position, depending on the age of the patient. So these valves are more suitable for the older patients. An advantage of tissue heart valves is that we do not need to thin the blood, and so we do not need to put the patients on warfarin with tissue heart valves. Another patient I saw today had his mitral valve repaired rather than replaced 4 years ago, and his mitral valve is doing very well, functioning very well. It is much better to repair the mitral valve rather than replace it because it is all your own tissue and will last your lifetime in most patients, and you do not need to go on warfarin. So I do repair most of the leaky mitral valves rather than replace it, but a small proportion of patients still need to have their valves replaced. So it's 3 p.m. now on a Saturday afternoon, and I'm going to go home now and hopefully have a bit of a rest. Thank you.